When a patient wants to come in for a dental implant, there are multiple steps we go through in order to create the best prognosis in the dental implant. We start with a consultation. So at the consultation, I'm going to take a look at the type of bone you have, how much bone you have, what teeth you're missing. We'll take some x-rays, maybe a CT to see how much bone you have there as well. And then we create a plan. Now, depending on how much bone, how strong your bone is, and how much stability we have at that day, we have lots of different options. So let's say you're missing a front tooth and you don't want to walk around with the missing front tooth, or maybe a flipper or a partial denture. Then if we do have good stability, then you can walk out that day with a crown. Another possibility is that when we place the crown, either it's not in a place where we are worried about placing a crown on it that day, maybe a back tooth. We will place what we call a cap or a healing cap or a screw on top of it, and basically that just helps protect the implant while it integrates into the bone. After it has fully integrated into the bone, we then are going to take an impression of the implant, and from that impression the lab can make a crown off of that. So all in all, from the day of placement of the bone till the final crown, it can be anywhere from approximately 4 to 7 months.